Hi, my name is Jessica Sanchez and I will be talking about phobias. I became interested in phobias a few months ago because I was watching a few YouTube videos and the YouTuber that I was watching talked about trypophobia, which is the fear of a cluster of small holes or bumps. For example, a honeycomb. For this speech, I will be explaining what phobias are and what causes them, the types of phobias there are, and give some information about specific phobias. So what does phobia mean? And what causes people to develop them? According to Merriam-Webster, a phobia is an exaggerated, usually inexplicable, and illogical fear of a particular object, class of objects, or situation. According to the website mind.org.uk, there is not one particular cause to phobias, but some factors play a role in their development, such as negative experiences, genetics, environment, brain function, and long-term stress. Now that I have told you what phobias are and how they're caused, let's get into what types of phobias there are. The Harvard Health Publishing website states that there are three major categories. They are specific phobias, social phobias, and agoraphobia. Specific phobias are partly genetic and run in families. According to Healthline, specific phobias develop between the ages of 10 and 13-year-olds. Some examples are dogs, dentists, dark places, and flying on an airplane. Social phobia is having a fear in a social situation where they may be humiliated, embarrassed, or judged by others. It is also known as social anxiety disorder. It can be generalized into avoiding eating in public or using a public restroom. Agoraphobia is the fear of being in public places where it would be difficult or embarrassing to make a sudden exit. They may also experience panic symptoms or have a panic disorder. By knowing the major categories, we can now look at other types of phobias. The first one is hemophobia, fear of blood. According to Healthline, 3 to 4% of the population has this phobia. I used to think that my sister had this phobia, but then I realized it doesn't let her affect her life. It's more of an factor to her, but it's not a phobia to her. The second phobia is ataxophobia, which is the fear of disorder and untidiness. It's often associated with obsessive compulsive disorder. The third and final phobia I will be talking about is arachnophobia, which is the fear of spiders. The website Healthline includes a list of symptoms which are shaking or trembling, shortness of breath, increased heart rate, and crying. I only mentioned a few of these because last night I was taking an exam and my niece out of nowhere just screamed. She came running to me and she was really shaky. Her heartbeat was really fast. Her face was kind of pinkish red. And she tried to tell me that there was a spider in her toys. And so she wouldn't go back there until my mom told her that the spider was gone. But even then she was still iffy about it. Let's see. So these are just some of the phobias that there are. There are so many more phobias out there. There's a fear of chickens. There's a fear of flowers. But if you're interested, I do suggest you to conduct more research on your own. So in conclusion, I did explain what phobias are and what causes them. I told types of phobias and gave information about certain phobias. Just like I saw some YouTube videos, you can learn about other specific phobias that I didn't mention. And lastly, phobias are the most common disorder in the U.S., and women are affected by it more than men. Approximately 15 million American adults are affected. Thank you.